Welcome to Joa Fitness Health Wellness Video Podcast, a space to ignite your day through positive conversations. We bring people that have created excellence in their life, sharing high vibration in their reawakening path.
Happy Friday! You are listening to Back into Alignment. My name is Joa Rivas and I am a yoga and Pilates teacher, a wellness coach for the last 12 years, and I am excited every Friday. I'm bringing a new guest and a new topic related to the spinal health. Why did I dedicate all this time about spinal health? Because I actually was diagnosed with scoliosis, which is a spinal dysfunction where your spine is tilted to one side or the other, and actually can create chronic back pain. And I had it for 10 years. It was no fun. I spent 10 years feeling pain in my spine, from my neck to my lower back. It was a constant pain when I was going to sleep and waking up. So that's not a fun life, right? And life is about finding the quality that we want to live for a long time. And I actually found a way to heal myself, and I could not keep it as a secret. So that's why I'm here to share with you how I heal my body and my spine within 12 years of no pain. It was amazing. And then it happens again. I have osteoarthritis and herniated disc and slip disc. One more time, the pain is teaching me to find solutions. And that's why I'm here with this journey. This journey is a never-end journey, and just giving me so much wisdom. So I hope you enjoy this. Please subscribe to the channel by clicking on the subscription button, or simply send comments and questions if you have related to your own body or to your family. I know we are also listening to the pain that our family are experiencing. Today we have Dave Ross. He's a physiotherapist from the University of McMaster. And what's the other university, Dave? Sorry.
Queen's University.
Queen's University. Yes. Thank you so much, Dave. Dave and I, we have been talking for 3 weeks about spinal health, and I'm excited to bring him one more time because last night he had a great webinar where he was talking about back pain and how to treat it, how to find lifestyle to be able to live with this, and how to reduce the back pain. So how are you, Dave? How is your morning going?
So far, so good. I can't complain. Unfortunately, my kids are homesick, but I'm still healthy, touch wood. And I'm trying to avoid them while also trying to help them.
Yes. Well, I hope your kids get well.
Thank you.
I know it's not easy to have the kids at home, but I'm sure some patience building there for sure. Hopefully they get better. For you guys to understand who Dave Ross is, he's a physiotherapist. He's the director of Eramosa Physiotherapy Clinic in Guelph in Ontario, here in Canada. As you see his background, if you're actually watching this on YouTube, he's living in the middle of the woods, right around the forest. Look at how beautiful. And he's been sharing with us topics that can affect us, talking about osteoarthritis, talking about back pain. Today, we are actually diving deep into the most common chronic pain that the whole population in the entire world is experiencing. We're talking about back pain is one of the world's biggest health problems, and it's something that most people will experience during some stage in their life. Maybe because you fall, maybe because you pull a muscle, because your sneeze, or maybe because you have some type of bone degeneration like I do. We explore a way how these detrimental effects can cost a lot of money for us. We're talking last week, it could be $2,000 a year to treat osteoarthritis, over $200 a month on prescription medication, which is not the only way to heal the spine. Actually, Dave Ross was sharing with us last week that lifestyle and nutrition is super essential to find healing in our spine. So yes, Dave, now please, let's just share about last night. How was the participation? We talk about fix your back pain, 5 steps to eliminate back pain.
Yeah, so it was really well attended. We had somewhere between 25 and 30 people show up, and this is a community talk that we do out of our clinics. just to kind of educate our local community from our clinics and help them learn more about their back and how to help themselves. So as you said, we kind of went through a bit of anatomy and then the 5 steps of how to kind of treat your back pain that we would typically go through in a physio progression of treatments and assessments. So yeah, it was a good time. Lots of good questions from the audience afterwards. I got several emails this morning, so it was good.
Yeah. Yes, yes. We are excited to bring education to our community. As you were telling, this is one of the aspects of finding healing. It's not only to find healing alone, it's actually understanding that this is affecting our neighbors, our family, our friends. We're talking 540 million people around the world are affected by back pain at any one time. 5% of people are struggling with back pain, and this back pain can actually develop into chronic back pain, like I actually used to have. And it seems like it wants to come back, but I'm not allowing the pain to come back to that level. I'm definitely really, this time I have way more wisdom. And I know when you are in pain, when somebody asks you, how are you? And you say 9 or 8. This is related to the pain, right? Like, how are you? I'm an 8. What do you mean? Well, I'm actually feeling pain. And I rate my quality of how I feel depending of the pain. Okay, that's not fun, right? So this is the whole goal of this podcast, is to bring you ideas about how we are actually developing our activities in the day and how we can decrease this pain so it doesn't move to be chronic, or it can actually be linked to other issues, right? So please, Dave, tell us a little bit about what you learned last night from the conversation with the people that participated. I know some people were asking you about what are the best ways to sleep, like what are the most optimal ways to sleep, which is so important. That's a great question. So please tell us about what would be the most efficient way to sleep so we can actually prevent back pain.
So I'm gonna start by saying there's 2 types of people. There's people, well, generally speaking, when it comes to back pain, people who prefer to be bent forwards, and they tend to be more the people who have the osteoarthritis and the bone issues. And then those that prefer to be bent backwards or at least straight, and they tend to be more of the disc herniation people. And so the reason why they want to be bent backwards or straight is so that they push the disc away from the nerves in the spine. And so your sleeping position is going to depend on whether you're somebody who likes to bend forwards or bend backwards.
Oh, okay.
So with that in mind, if you're, often people are side sleepers. I would say the majority of people are side sleepers. Regardless of whether you prefer one position or the other, you want to try to get your spine as kind of neutral as possible, not bent one way or the other. And so a big part of that is the hips. Women in particular, your hips widen when you get to childbirthing age to make room for the baby's head to come through your pelvis. And, you know, I'm not trying to be sexist, that's just human anatomy, right? And in order for that to happen, your hips widen, but your knees stay narrow. And so if you keep your knees kind of in the same place, one on top of the other, what it does is create kind of a slant in your pelvis, pulling the pelvis forwards, and then it twists through the spine. So one of the best things to do is to either get a body pillow or at least a bigger pillow to put between your knees so that your back stays nice and straight and level. And then in terms of the bend, whether you're bent forwards into a full fetal position or kind of bent backwards or neutral, that will depend on your flexion bias or extension bias. Sometimes the people with disc herniations, they'll actually prefer to sleep on their stomachs with a pillow kind of propped up under their head. And that's because, like I was saying before, it pushes the disc away from the nerve, away from the spinal cord, and then they're much more comfortable that way. It's not a great position for your neck, though. So often I find those people come in a couple months later because they've got neck problems.
Okay. Oh, wow. Okay, so to sleep, you recommend, if you're sleeping sideways, to get a body pillow to level the position of your knee and your hip so it doesn't create an overstretch of your IT band, I believe. That would be like more improper.
The IT band, but also rotation through the spine.
Okay, rotation on the spine. That's a good point. Your hip will be level. It wouldn't be rotated for 8 hours. Like how many hours do we sleep, right? It's like a third part of our life we spend, hopefully, sleeping. So definitely we have to make sure. The body pillows, are those like for pregnant women, right? That's the ones that you're talking about.
They do make special ones for pregnant women, but they sell them at Walmart for everybody. Okay. You don't have to be pregnant to use a bodybuilder.
Yeah, they're like $20. You know, it's a good investment. It may last 1 year, right? But it is a good investment for sure. Like you were telling, women are actually affected more on back pain. Those over 30 and people who are class on obesity, like obese, they actually have a greater risk of developing lower back pain. We actually talked about this before. Obesity, lower back pain, or osteoarthritis, they're all correlated together. So here we're not only educating you about our physical body, but also how we are actually taking care of our body composition, which is very important. Now, something that I remember last time you were talking about was about how women are more open to search and seek for support and for help when they actually experiencing pain. And perhaps that's why we have more data about women instead of men, because men tend to be more into like, I find my way to solve this is going to go away. And it happens that sometimes they leave it until it's, chronic, right? So this is actually really interesting, that approach, which we don't think how women are actually a little bit more in tune with their bodies. So this is another insight for you. If you're a man and you're listening to this, please be open and come and research, and actually don't be afraid of ask for help. That's why we have professionals helping you to decrease the pain, and it happens. I know this is actually a very interesting topic. Now, another question that people ask us are related to the way as we actually move in our daily activities, right? So let's say now with the smartphones, which are not so smart sometimes, what would be the most appropriate position when you're using a phone or a tablet to be able to generate that issue called the forward head posture? How can we actually prevent our body to develop a back pain?
Yeah, so just so that everybody knows who is watching, the forward head posture is when they do this, right? They've got their phone in front of them, the head's poked forwards, or they're just all the way down like this.
Chin in, yeah. When your chin is in, or when your neck is overstretched, trying to see, perhaps you may need to check your eyes, right? Yeah. But okay, so what would be the best to do, especially for our teenagers? You have almost two, kids moving towards a teenager. So don't you see them sometimes like already developing this position?
Yeah, right? Thankfully my kids are in figure skating and dance, so they get their coaches hammer away at them for having good posture. So it means I don't have to do it as much.
Great. But, yeah.
If that's not the case for your kids, or if you're an adult and you struggle with this, there's lots of exercises we can do. The first thing is just every hour set a timer on your phone or your smartwatch, or whatever other technology you've got, so that you just pull your head backwards and then squeeze your shoulder blades back. Give it, good squeeze there. Hold it for 5 seconds, and then after the 5 seconds, just relax, take a breath. If you do that 10 times for 5 seconds every couple hours, it's amazing how much that can help.
Mm-hmm. I hope you guys took note, and right away, take your phone, my friends. Let's do this right away. And that's what I actually apply with all my online clients. I set up notifications in an app that they are part of, where they do, I call it morning interrupter and an afternoon interrupter, because sometimes we get into this like we just on work mode, right? Work mode, we're not thinking about anything. But if we could have a mirror in front of us or in the side, we're like, oh my gosh, look at how I'm sitting, I can't believe, right? Maybe tell your coworker or somebody that is seeing you, like, hey, if you see me hunch over, please tell me. But one of the best ways is like what you just said, have your phone, have a timer, and once in the morning and once in the afternoon, try to do some type of body pattern interrupter where you can actually reset your posture. Like you say, perhaps you can do shoulder blades back away from your ears, or you can do maybe like a neck stretch, or maybe you can do breath work where you just focus on breathing with a box breathing, which is 4 seconds in, you pause for 4 seconds, so you hold it, and then you exhale for 4 seconds, then you pause again. So every breath is about 16 seconds. Every minute you do 4. So let's say, okay, I'm gonna practice as simple as 1 minute of practice of box breath. Very simple. I think at the beginning is simplicity and consistency. You don't have to make it super hard. You also have to be like, I'm gonna plan to go to the gym. No, literally where you're sitting right now at office. We're talking because back pain is one of the most common reasons for missing a day of work. Nearly 4 in 10 office workers will experience lower back pain. And perhaps this is you, or this is even me. I know how it feels. So please, this is awesome to have reminders. That was a very good tip for everybody. As you were talking, when I was asking you about your webinar, you were saying that people have a bias, right? They either extending or flexing their bodies, right? So, like, you're talking about someone that is wearing high heels. How the woman, they're wearing high heels, how this actually disrupt the whole posture and spine?
Sure. So when you wear high heels, your feet go forwards and then your body naturally has to lean back to compensate. So what that will do is put extra pressure on the posterior aspects of your spine. So the way our spine works is we have a big kind of bone at the front, and then there's bone that comes off the back. It kind of forms a tail, the spinous process. That's the part that you can actually touch when you feel your back. And then it forms a ring like that the spinal cord goes through. And so when we lean backwards and put that posterior pressure on it, we can pinch the spinal nerves if there's any osteoarthritis in there or other issues. And so that can impact the spine and cause pain. The other thing it does is just it makes all of those muscles at the front and all the way around have to work harder because we are leaning now. And you know, I think high heels were invented by mean men somewhere many, many years ago, because it changes women's posture. They're terrible for your feet. It causes bunions in the feet. And it forces you to kind of lean back so that it elevates you, but it also puts you in a position of kind of weakness because you're always off balance. So you can probably tell from what I'm saying, I'm not a huge fan of high heels. I know lots of women wear them because, you know, culturally it's a beautiful thing. But I would encourage you that unless you need to wear them or, you know, fancy events, whatever, great. But if you're just going into the office, just wear something comfortable.
Yes, of course. Of course, I totally understand you. I actually had podiatrist from Australia, from Melbourne, and a shout out to Dr. Andy Bryant. He was amazing. We talked a year ago about minimalistic shoes and how to develop a proper way of walking or dancing, you know, because some people say that walking is like dancing, you know, just find your rhythm. And definitely shoes, high heels will influence in the way as we walk. Trust me, woman, I love high heels because the calf and the legs, everything looks nice and long, but definitely you are in a risk of getting a sprain in the ankle, which happens at least once. I know it happens. And it also develops this imbalance. Some muscles are overstretched, some muscles are shortened. And the lower back, actually, a lot of impact on the lower back. I see this. So my recommendation for all women that are listening to this podcast right now is to have a bag that you will carry with your sexy shoes for the time that you need to be, you know, wearing them, let's say 2 hours maximum, and then have your proper minimalistic shoes when you have a chance. If you're in the office and you're sitting, you don't need to wear high heels when you're sitting, do we? And then perhaps if you really have a dinner and you want to just walk to the restaurant or go into this meeting with your high heels, try to wear them as minimum as possible to reduce the effect in our spine. We were talking about the spinal cord. The spinal cord carries information to and from the brain to the body, So basically, this type of spinal and nerve impingement can actually create a lot of disruption with our bodies. And Dave, I took this program from Posture Pro. It's my school. I love Annette. She does amazing researches about vestibular system, which we will be talking next week about the vestibular system, vertigo, dizziness, that is actually part of our spinal cord. And she was explaining that sometimes when your hip flexors are tight, perhaps it's because you have lost sensitivity on the plant of your feet. And by simply giving a stroke with a fork in the plant of your feet, you actually connecting your brain with the spine, and that could actually decrease the inflammation on your hip, and you can actually improve your hip flexor mobility, which is ridiculously amazing. It's fascinating to see how actually the plant of your feet is connected to our spine and perhaps connected to particular areas that have been numb by your brain. So I love this approach, and I can't wait for you to share more about the vestibular system. It's been now affecting a lot. I feel a lot of people have tinnitus and vertigo and ear issues. I'm not sure exactly what's the source. If Dave can bring this next week, I will be loving to hear and to know all this information. Before we finish our conversation today, I wanted to talk about how to loosen up above and below our spine.
Sure. So, specifically if we're talking about the spine, loosening up above would be kind of the upper back, the middle back, so between our shoulder blades, the thoracic spine where our ribs attached to. So lots of rotational stretching through there is really good. It's hard for me to demonstrate right now with these headphones attached to me, but basically, if you think you're lying on your side, and I'm going to kind of pull this down a little bit. You're lying on your side with your legs firmly attached, or firmly bent up as high as your knees will go, like you're marching, but with both legs, arms like this. You want to take one arm and open it up as far as you can. So kind of like a warrior pose, but lying down with your legs bent
sideways. Okay. So you basically, as when you sleep on the side, so mind you are sleeping sideways, and now you bring one arm to the opposite side. That's a great thoracic rotation. Yeah. Chest opener, lower back stretch. I love that one. Great. Yeah. So that's for the upper body. What about how to loosen up the below the hip?
Well, before we jump there, I just want to say, if you're familiar with yoga, thread the needle position is a really good one. Child's pose is really good to loosen up the upper back. Cat and camel is a really simple one. So for our patients who are in a lot of pain, we'll usually start with that because it's very basic, very easy to just stay within your pain limits. So a few different ideas there in terms of levels of difficulty. And then kind of the maximum thing that I would encourage everybody to do, especially if you spend your day sitting, would be to get a foam roller and put it perpendicular to your spine and then roll over backwards so that it really helps promote that extension through your spine. You may even feel some cracks and pops, and that's okay. That's just you stretching open the joints and gas coming in. So moving on to the second question, the hips and the lower part, stretching out your glutes and your hip flexors, depending, again, if we go back to that bias that we talked about earlier, if you're in a flexion bias, your hip flexors are going to be tight and your glutes are going to be loose. So we want to strengthen the glutes and stretch out the hips flexors. In the opposite, where you're bending backwards now, your hip flexors will be loose, but your glutes might be really tight, as well as your hamstrings. So hamstring stretches, glute stretches, there's many versions of those, but they all kind of get at the same thing. I also encourage people to foam roll those areas as well as their IT bands, which I know we mentioned earlier in the postural thing. A lot of people, when they sit all day, their TFL muscles, which is a small muscle in the outside of their hips, gets really tight. That connects to the IT band and then pulls it really tight and can cause all sorts of hip and knee issues.
Mm-hmm. Exactly. We gotta also release tension around your hips, especially around your glutes. I particularly have in this moment an slip disc in my sacrum, and I have 4 herniated discs, and I have also osteoarthritis. So I understand what it is to feel pain every day. And I am practicing this more often. And it makes me realize every time I have a talk to a health professional like you, that our health is about practicing daily. And even if you heal, doesn't mean that you're going to stop. It means that worked for you. So you got to continue practicing that. I am a yoga Pilates teacher, and I still develop all what I'm telling you. So I'm just coming from the wisdom of pain and understanding that we need to create habits that actually can help us to have the best body we can as we are here in this life path. Now, for the last one is this very important message that I learned from one physiotherapist before, is that don't wait to have pain to visit a clinic or to visit a physiotherapist like Dave. If you have a symptom and it's recurrent for over a week, I think it's time to check by getting a proper x-ray, proper ultrasound, proper MRI to discard any issue that could be affecting you. The sooner, the better. And remember, your body is the unique asset you have for life. So take care of your body, my friends. I hope this conversation with Dave, it brought you some great tips and insights for your own body and your family. Share with your family and friends, especially if they are experiencing back pain. If you want to contact Dave, you can also check in the chat box all his social media, including his Instagram and his Eramosa Physiotherapy Clinic, where you can actually contact him and see him on Wealth. Dave, tell us a little bit about October, how and what are you planning for the rest of the year?
October, November's are our busiest time at the clinic, so we're just ramping up. Lots of people are coming in with now that the gardening's done, they want to get their backs stronger for raking the leaves and shoveling the snow. So if you're noticing any issues now, it's time to deal with them before the heavy snow gets here. But yeah, it's nothing crazy going on in the fall, just having fun and playing with the kids.
Mm-hmm.
What about you?
Right. Well, I actually totally preparing myself, but not to shovel no snow. Hopefully I'm going to be going away for the winter for at least a time to connect to my sunshine. But yes, that's such a good idea to start training everybody to get the spine strong, to start shoveling snow coming soon in winter. And gardening definitely can put so much pressure on the spine. So definitely good reminders for us to maintain our spine in an integral position. But yeah, no, I'm always creating new programs. I'm following now the Brain Body program, which is a 7-day program. Basically, if you never actually thought about the connection between your brain and body, these exercises will bridge this gap by putting efforts into release your jaw. If you're actually experiencing TMJ, we do have exercises to release your TMJ, to position your tongue. The posture of your tongue is very important, especially if you have a newborn. It's important to check the tongue of your newborn. And also we work on the stimulation of the eye training, and this actually will help you with your entire spatial way to position your body and walk. So actually I love this program because it's just opening a new practice that sometimes we forget and we actually don't even know about it. And I still have the 30-day hip healing, which is like similar to what we were talking. Is just creating pattern interrupters to do stretches and to stimulate our brain and body through simple exercises and simple habits. And then I have the Posture School program, which is actually the 4-month program, which is 16-week on yoga, Pilates. We have dynamic movement, we have resistance training, we have a lot of breath work, which is very important to stimulate our parasympathetic in a way that we can be calm and finding solutions and be aware of our emotions. And actually it will improve your gut health, which is important for us. So all this is part of what we do together. I love to connect to doctors, and we have one more talk with Dave Ross. So please, within the week, if you have questions, send it to us. We will develop this for next week. We will be chatting about the vestibular system. And if you have anyone that will value the talk from today, please share with them. Thank you so much, Dave. I'm looking forward for our next call. And remember that together we are stronger.
We invite you to subscribe to this channel and share with your community. Please leave comments below, and if you like the episode, click the like button. Have a beautiful day.